بسم الله الرحمن الرحيم. أبناء الطلاب وزملاء أطباء الدراسات العليا، يسعدني أن أقدم لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
In this film, we are going to describe the skull. The skull or cranium is divided into two parts: the calvaria or skull cap and the facial skeleton. For the convenience of description, the skull is described from various aspects: from the superior aspect or norma verticalis, the anterior aspect or norma frontalis, the lateral aspect or norma lateralis, the posterior aspect or norma occipitalis, and from the base or norma basalis. The skull in general is composed of large number of bones that articulate together at the sutures. Now we are going to describe the superior aspect of the skull or norma verticalis. This superior aspect shows the frontal bone anteriorly, the occipital bone posteriorly, and the two parietal bones in between. The frontal bone articulates with the two parietal bones at the coronal suture, which extends from side to side. The occipital bone articulates with the two parietal bones at the lambdoid suture. The two parietal bones articulate with each other in the median plane at the sagittal suture. The sagittal suture meets the coronal suture at a point called bregma. And meets the lambdoid suture at a point called lambda. On each side of the posterior part of the sagittal suture, there is the parietal foramen, which is an emissary foramen. An emissary foramen transmits an emissary vein, which is a vein connecting the dural sinuses inside the cranial cavity with the veins outside the skull. In the infant, the bregma is a soft membranous area called the anterior fontanelle, which closes by ossification of the neighboring bones by about the 18th month after birth. Similarly, the lambda is membranous before birth and is called the posterior fontanelle, which closes by about the 3rd month after birth. The anterior fontanelle is of clinical importance as it is used to determine the exact position of the fetal head during labor and to assess the degree of bone development. In case of rickets, the anterior fontanelle shows delayed closure. Now we are going to describe the anterior aspect of the skull or norma frontalis. This anterior aspect shows the forehead, the orbits, the external nasal aperture, and the upper and lower jaws. This is the forehead. It presents the superciliary arches, which are more prominent in the male than in the female. The frontal bone articulates with the nasal bones at the nasofrontal suture, which meets the suture between the two nasal bones at a point called nasion. The area just above the nasion is called glabella. In the child, the frontal bone is formed of two halves that articulate together in the median plane. The two halves fuse together by about the 8th year after birth, with disappearance of the intervening suture. But in some cases, this suture may persist in the adult and is called metopic suture. This is the orbit. It is pyramidal in shape, having a base that opens on the face, and an apex which opens into the cranial cavity. The base of the orbit has four margins: the superior, inferior, medial, and lateral. This is the superior orbital margin. It is formed wholly by the frontal bone. It shows in its medial part the supraorbital notch and the foramen, which transmits the supraorbital nerve and vessels. Just medial to the supraorbital notch, there is the supratrochlear notch, which transmits the supratrochlear nerve and vessels. This is the inferior orbital margin. It is formed by the maxilla medially and the zygomatic bone laterally. 1 centimeter below the middle of the border lies the infraorbital foramen, which transmits the infraorbital nerve and vessels. This is the medial orbital margin. It is formed by the frontal process of the maxilla and the maxillary process of the frontal bone. Just behind it, you find the lacrimal fossa, which is formed partially by the lacrimal bone. The lacrimal fossa lodges the lacrimal sac, which opens into the nasal cavity by the nasolacrimal duct. This is the lateral orbital margin. It is formed by the zygomatic process of the frontal bone and the frontal process of the zygomatic bone. The cavity of the orbit has a roof, floor, medial wall, and lateral wall. The roof is formed by the orbital plate of the frontal bone anteriorly, and the lesser wing of the sphenoid bone in its most posterior part. The fossa for the lacrimal gland lies at the anterolateral angle of the roof. The floor is formed mainly by the maxilla, in addition to the zygomatic bone and the palatine bone. It presents the infraorbital groove and the canal, which transmit the infraorbital nerve and artery. The medial wall is the thinnest wall of the orbit and is formed mainly by the ethmoid and the lacrimal bones, in addition to some contribution from the frontal and sphenoid bones. The lateral wall is demarcated posteriorly by the superior orbital fissure, and the inferior orbital fissure lies below. The superior orbital fissure communicates the orbit with the middle cranial fossa and transmits the ophthalmic veins and the third, fourth, and sixth cranial nerves, in addition to the ophthalmic division of the trigeminal nerve. The optic canal is just medial to the superior fissure and transmits the optic nerve and ophthalmic artery. The inferior orbital fissure communicates the orbit with both the infratemporal fossa and the pterygopalatine fossa. It transmits the continuation of the maxillary nerve, which is called the infraorbital nerve, and the branch from the maxillary artery called the infraorbital artery. This is the zygomatic bone. It articulates with the zygomatic process of the temporal bone to form the zygomatic arch, which lies in the lateral aspect of the skull. This is the maxilla. It encloses the maxillary air sinus and forms the upper jaw. Its process, which carries the teeth, is called the alveolar process, and its process, which forms part of the hard palate, is called the palatine process. The growth of the maxilla is responsible to a large extent for the elongation of the face, which is especially marked between the age of 6 and 12 years. This is the external nasal aperture. It is bounded by the two nasal bones above and by the two maxillae from the sides and below. This is the anterior nasal spine, which projects forward from the lower border of the aperture in the median plane. Now we shall move to describe the lateral aspect of the skull, or norma lateralis. This is the zygomatic arch. It extends anteroposteriorly in the side of the skull and separates the temporal fossa above from the infratemporal fossa below. It is readily palpable under the skin, and its upper border corresponds to the base of the cerebrum. Its lower border gives origin to the masseter muscle. This is the temporal fossa. It is bounded by the temporal line from above and by the zygomatic arch from below. The temporal line begins anteriorly at the zygomatic process of the frontal bone and then arches across the side of the skull to end posteriorly by joining the supramastoid crest, which is a ridge above the mastoid process. The temporal line gives origin to the temporal fascia, which is deep fascia covering the temporalis muscle. The temporalis muscle itself arises from the whole floor of the temporal fossa, and its tendon passes deep to the zygomatic arch to get insertion into the coronoid process of the mandible. The temporal fascia is attached below to the zygomatic arch. The floor of the temporal fossa is formed by 4 bones: the frontal, parietal, squamous temporal, and the greater wing of sphenoid. These 4 bones articulate together at the pterion, which is an H-shaped suture. The pterion is of surgical importance as it overlies the frontal branch of the middle meningeal artery. The pterion is demarcated on the surface by a point that lies at 4 centimeters above the midpoint of the zygomatic arch and 4 centimeters behind the zygomatic process of the frontal bone. Injury to the middle meningeal artery results in an extradural hemorrhage. This is the infratemporal fossa. It lies below the zygomatic arch and behind the maxilla. The ramus of the mandible limits the fossa laterally, while the lateral pterygoid plate of the sphenoid bone limits it medially. It has the following communications. First, with the temporal fossa through the gap deep to the zygomatic arch. Second, with the orbit through the inferior orbital fissure. Third, with the pterygopalatine fossa through the pterygomaxillary fissure, which is a gap between the back of the maxilla and the lateral pterygoid plate. The infratemporal fossa contains important structures. The lateral and medial pterygoid muscles, the maxillary artery, the mandibular nerve, the pterygoid plexus of veins. This is the pterygopalatine fossa. It is located between the pterygoid process of the sphenoid bone and the palatine bone. It contains the maxillary nerve, which crosses the fossa after it emerges from the foramen rotundum to enter the infraorbital fissure. The pterygopalatine ganglia is suspended from the nerve in this fossa. Furthermore, the maxillary artery ends inside the fossa, where it gives off many branches. This fossa communicates with the nasal cavity through the sphenopalatine foramen medially, with the infratemporal fossa through the pterygomaxillary fissure laterally, with the orbit through the infraorbital fissure anteriorly, with the middle cranial fossa through the foramen rotundum posteriorly, with the palate through the greater palatine canal downwards, with the pharynx through the pterygoid canal posteriorly. This is the external auditory or acoustic meatus. The floor, anterior wall, and the posterior wall of this meatus are formed by the tympanic plate of the temporal bone. Immediately above and behind this meatus, there is the suprameatal triangle, which is bounded above and in front by the supramastoid crest, anteriorly by the postero-superior edge of the external auditory meatus, and posteriorly by a line tangent to the posterior margin of the external auditory meatus. This triangle overlies the mastoid antrum, which is a cavity present just posterior to the middle ear and communicates with it through an adytus. This is the mastoid process. It is a part of the temporal bone and is filled with air spaces called the mastoid air cells. The mastoid process is absent at the time of birth and develops by the second year, and as a result, the stylomastoid foramen gets a deeper position and the facial nerve emerging from it becomes shifted away from the surface. The facial nerve is exposed to the danger of cutting in incisions just behind the ear in infants. The outer aspect of the mastoid process gives insertion to the sternomastoid muscle, while its deep aspect gives origin to the posterior belly of the digastric muscle. The mastoid process is more prominent in the male than in the female, and is used in sexing the skull, as the case with the prominence of the superciliary arches. This is the styloid process. It is a part of the temporal bone that projects downwards and forwards from under the cover of the tympanic plate. It gives origin to three muscles and two ligaments: the styloglossus muscle to the tongue, the stylopharyngeus muscle to the pharynx, the stylohyoid muscle to the hyoid bone, the stylohyoid ligament to the hyoid bone, and the stylomandibular ligament to the angle of the mandible. Now we shall move to describe the posterior aspect of the skull, or norma occipitalis. This aspect is formed by the occipital bone, mastoid parts of the temporal bone, and parts of the parietal bones. This surface presents the external occipital protuberance, which is a median projection present midway between the lambda and the foramen magnum. At this point, corresponding to the top of the external occipital protuberance, is called the inion. This protuberance gives attachment to the ligamentum nuchae of the neck and gives origin to the trapezius muscle. On each side of it, there is the superior nuchal line, which runs laterally. This line marks the junction between the head and back of the neck and gives origin to the trapezius muscle. Sometimes a faint line appears 1 centimeter above and parallel to the superior nuchal line and is called the highest nuchal line. That gives origin to the occipital belly of the occipitofrontalis muscle of the scalp. The point of meeting of the lambdoid suture, the parieto-mastoid and the occipitomastoid suture, is called astrium. The mastoid foramen is an emissary foramen found near the occipitomastoid suture. It transmits an emissary vein to the sigmoid sinus. This is the temporal bone. It comprises many parts. Squamous part, which is thin. Mastoid part, including the mastoid process. Tympanic part, which forms the floor, anterior wall and posterior wall of the external auditory meatus. The styloid process, which is not shown in this specimen because this is a young bone. And lastly, the petrous part, which is the hardest part and includes of the middle ear and the internal ear. Note that the squamous part gives a zygomatic process which is called zygoma. That meets the zygomatic bone to form the zygomatic arch. This is the sphenoid bone. It consists of a median part called the body of sphenoid, which includes the sphenoid air sinus, and has the fossa for the pituitary gland. 3 pairs of processes are attached to the body. These are 2 greater wings, 2 lesser wings, and 2 pterygoid processes, 1 on each side. The greater wing has a horizontal part which forms the floor of the middle cranial fossa and presents 3 foramina, and a vertical part that ascends on the side of the skull to reach the cerium. The lesser wing is separated from the greater wing by the superior orbital fissure. The pterygoid process projects downwards and is formed of 2 plates, a lateral pterygoid plate laterally and a medial pterygoid plate medially, and a pterygoid fossa in between the 2 plates. Now we are going to describe the inferior aspect of the skull or the base from outside. From before backwards, the base consists of the bony palate and the alveolar process in the most anterior part, and the occipital bone in the most posterior part, while in the intermediate area, the skull consists of the occipital, the sphenoid, and the temporal bone. This is the bony or hard palate. It forms the roof of the mouth and the floor of the nasal cavity. It is formed by the palatine process of the two maxillae in front and the horizontal plates of the two palatine bones behind. Just behind the incisor teeth, there is the incisive fossa, through which the nasopalatine nerve passes from the nose to the palate. The posterior border gives attachment to the soft palate and presents the posterior nasal spine in the median plane. At the posterolateral angle of the hard palate, there is the greater palatine foramen, which is the lower end of the greater palatine canal, reaching up to the pterygopalatine fossa and transmits the greater palatine nerve and vessels. Just behind the greater palatine foramen, there are one or two lesser palatine foramina that transmit the lesser palatine nerves and vessels. The alveolar process arches around the hard palate and carries the sockets of the teeth, which are arranged on each half of the process as follows: 2 incisors, 1 canine, 2 premolars, and 3 molars. The most posterior end of the alveolar process is a tubercle called the maxillary tuberosity, which gives attachment to the superficial head of the medial pterygoid muscle. The nasal cavity is continuous with the nasopharynx through the choanae, which are the 2 large posterior nasal apertures. They are separated from each other by the vomer, which forms the most posterior part of the nasal septum. Each corner is bounded laterally by the medial pterygoid plate. The vomer lies on the undersurface of the body of the sphenoid and has an ala on each side. This is the pterygoid process with its 2 plates, the lateral pterygoid plate and the medial pterygoid plate with the pterygoid fossa in between. Tracing the medial pterygoid plate upwards, you find that it splits to form the scaphoid fossa for the origin of the tensor palatine muscle. While proceeding downwards towards the hard palate, you come across a hook-like process called the pterygoid hamulus, to which the pterygomandibular ligament is attached. Note that the lateral pterygoid plate gives origin to the lateral pterygoid muscle from its outer surface and to the medial pterygoid muscle from its inner surface. This is the basilar part of the occipital bone that extends from the foramen magnum to the body of sphenoid bone, which lies under the vomer. In young age, the basilar part is united with the sphenoid bone by cartilage, which ossifies by about the 25th year. Immediately in front of the foramen magnum, the pharyngeal tubercle is found. It gives attachment to the median raphe, into which the constrictor muscles of the pharynx are inserted. On each side of the basilar part of the occipital bone lies the petrous part of the temporal bone, which fills the angle between the basilar part medially and the greater wing of sphenoid laterally. Lateral to the petrous part, you find the squamous part of temporal bone represented by the mandibular fossa and the articular tubercle. So, from medial to lateral, observe the following bones: basilar part of occipital bone, petrous part of temporal bone, greater wing of sphenoid, and squamous part of temporal bone. Behind the squamous part of temporal bone and continuous with it is the rest of the temporal bone, which comprises the tympanic part, the styloid process, and the mastoid part. Coming back to the petrous part of temporal bone, observe that its apex is irregular and separated from the basilar part of occipital bone and the root of the medial pterygoid plate by the foramen lacerum. Lacerum means irregular and lacerated. This foramen in the living condition is closed by a plate of cartilage. The medial border of the petrous temporal comes in contact with the basilar part of occipital bone, and if you follow this junction posteriorly, it leads to the jugular foramen. Just in front of the jugular foramen, spot the carotid canal. Note that the jugular foramen lies between the petrous temporal bone and the occipital bone, while the carotid canal is in the petrous temporal bone itself. The jugular foramen transmits the internal jugular vein, the inferior petrosal sinus, and the three nerves, namely the glossopharyngeal, vagus, and the accessory. The carotid canal transmits the internal carotid artery, surrounded by sympathetic fibers coming from the superior cervical sympathetic ganglia. The lateral border of the petrous temporal comes in contact with the greater wing of sphenoid, where the groove for the cartilaginous part of the pharyngeal-tympanic tube lies between them. Tracing this groove posterolaterally, it leads to a bony canal that enters the middle ear, also called the tympanic cavity. This bony canal transmits the bony part of the pharyngeal-tympanic tube and the tensor tympani muscle above the tube. The horizontal part of the greater wing of sphenoid shows the foramen ovale, close to the lateral pterygoid plate. It is oval in shape and transmits the mandibular nerve, in addition to the lesser petrosal nerve and an emissary vein. Behind the foramen ovale lies the foramen spinosum, so called because it lies just anterior to the spine of the sphenoid. The foramen spinosum transmits the middle meningeal artery and the nervus spinosus, which is a meningeal branch from the mandibular nerve. The spine of sphenoid is related to two nerves, the auriculotemporal nerve laterally and the chorda tympani medially. The styloid process is encased laterally by the tympanic plate of temporal bone. Just behind the styloid process, between it and the mastoid process, there is the stylomastoid foramen, which transmits the facial nerve. This nerve supplies the muscles of facial expression. The mandibular fossa is for articulation with the head of the mandible, immediately anterior to the tympanic plate. In this fossa, the tympanic plate is separated from the squamous part of the temporal bone by the squamo-tympanic fissure. The medial part of this fissure transmits the chorda tympani as it comes out of the tympanic cavity to join the lingual nerve in the infratemporal fossa. The articular tubercle is an elevation just anterior to the mandibular fossa, and both of them articulate with the head of the mandible to form the temporomandibular joint. Medial to the mastoid process, there is the mastoid notch that gives origin to the posterior belly of the digastric muscle. Just medial to the notch, there is a groove for the occipital artery on its way to the back of the head. This is the foramen magnum. On each side of the foramen magnum, there is an occipital condyle for articulation with the upper surface of the atlas to form the atlanto-occipital joint, where a slight flexion and extension of the head are allowed, but no rotation. Rotation takes place at the atlanto-axial joint between the atlas and axis vertebrae. Just above the anterior end of the occipital condyle, spot the anterior condylar canal, which is called the hypoglossal canal because it transmits the hypoglossal nerve. Sometimes you find a small foramen just below the occipital condyle and is called the posterior condylar foramen that transmits an emissary vein. Behind the foramen magnum, there is the external occipital crest, which extends as a median ridge from the foramen magnum to the external occipital protuberance. It gives attachment to the ligamentum nuchae of the neck. About midway between the foramen magnum and the external occipital protuberance, you find the inferior nuchal line, which extends laterally on each side, parallel and below the superior nuchal line. The muscles of the back of the neck are attached to these lines and the area in between them. Now we are going to describe the cranial cavity, starting by describing the skull cap. The internal surface of the vault of the skull, or skull cap, shows a sagittal groove in the median plane that corresponds to the sagittal suture. It lodges the superior sagittal sinus. On each side of the sagittal groove, there are a number of granular pits that lodge the arachnoid granulations and are more evident in old age. Through the arachnoid granulations, the cerebrospinal fluid passes from the subarachnoid space to the superior sagittal sinus. On the internal surface of the side of the skull cap, there are the grooves for the middle meningeal vessels. The floor of the cranial cavity is formed by the upper surface of the base of the skull. It is divided into three fossae: anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Now we're going to describe the anterior cranial fossa. This is the anterior cranial fossa, which lodges the frontal lobe of the brain. Its floor is formed by three bones: the ethmoid bone, the orbital plate of the frontal bone, and the sphenoid bone. It presents the crista galli, which is a median projection from the ethmoid bone. On each side of the crista galli, there is the cribriform plate of ethmoid, which transmits the fibers of the olfactory nerve through its foramina. Immediately anterior to the crista galli, there is the foramen cecum, which generally ends blindly, but open into the nasal cavity and transmits an emissary vein from the nasal mucosa to the superior sagittal sinus. The orbital plate of the frontal bone forms the roof of the orbit and meets posteriorly with the lesser wing of the sphenoid, which forms the sharp free posterior edge of the anterior cranial fossa. Middle cranial fossa. This is the middle cranial fossa. It consists of a medium narrow part and two expanded lateral parts, one on each side. The median part is formed by the body of a sphenoid, whose superior surface shows the hypophyseal fossa that lodges the hypophysis cerebri, or pituitary gland. Anterior to the hypophyseal fossa, there is the groove for optic chiasma. This groove leads on each side to an optic canal which transmits the optic nerve and ophthalmic artery. The area of the superior surface of the body of the sphenoid is bounded by the groove for optic chiasma in front and by the dorsum celli behind, and is called sella turcica. The dorsum celli projects on each side to form the posterior clinoid process, which gives attachment to the peripheral or attached margin of the tentorium cerebelli. The medial end of the lesser wing of the sphenoid projects as the anterior clinoid process, which gives attachment to the free edge of the tentorium cerebelli. Inside the body of the sphenoid, there is a sphenoidal air sinus, and on its side there is the groove for the internal carotid artery. This is the lateral aspect of the middle cranial fossa. Its floor is formed mainly by the greater wing of the sphenoid, in addition to contributions from the pitras and squamous parts of temporal bone. It lodges the temporal lobe of the brain. It is limited in front by the lesser wing of the sphenoid and behind by the upper border of the pitras temporal. The superior orbital fissure is a slit between the greater and lesser wings of the sphenoid. It transmits the ophthalmic veins and the third, fourth, and sixth nerves, and the ophthalmic division of the fifth nerve. Immediately behind the medial end of the fissure, there is the foramen rotundum. Rotundum means rounded, which transmits the maxillary nerve to the pterygopalatine fossa. Behind the foramen rotundum, there is the foramen ovale, which transmits mainly the mandibular nerve, in addition to the lesser petrosal and emissary vein. Posterior and lateral to the foramen ovale lies the foramen spinosum, which transmits the middle meningeal artery and nervus spinosus. The groove for this artery extends forwards and laterally from the foramen towards the lateral end of the lesser wing of the sphenoid. The anterior division of the artery grooves the internal surface of the pterion and then arches backwards across the parietal bone. At the pterion, the groove may be converted into a canal. The foramen lacerum is located between the pitras temporal and the sphenoid bone. The carotid canal, which transmits the internal carotid artery, passes through the pitras temporal and ends at the foramen lacerum. The internal carotid passes over the floor of the foramen lacerum, which is filled with cartilage. The anterior surface of the pitras temporal presents three main features. Most medially, there is a depression for the trigeminal ganglia. It is enclosed within a dural sheath called cavum trigeminal. Most laterally, the bone forms the roof of the middle ear and the mastoid antrum and is called tegmen tympani. In between these two areas, there is the arcuate eminence, which is produced by the anterior semicircular canal. This eminence is related anteriorly to two narrow grooves, one for the greater petrosal nerve and the other for the lesser petrosal nerve. The later groove continues to the foramen ovale. Posterior cranial fossa. It lodges the cerebellum and the lower two-thirds of the brain stem, which comprises the pons and the medulla oblongata. The fossa is covered by the tentorium cerebelli, which is a fold of dura mater that separates the cerebellum from the occipital lobe of the cerebrum. This fold is attached anteriorly to the superior border of the petrous bone and posteriorly to the lips of the transverse groove which lodges the transverse sinus. The groove for the transverse sinus turns downwards, just behind the base of the petrous temporal sigmoid groove. That lodges the sigmoid sinus, which ends at the jugular foramen to become the internal jugular vein. It is to be noted that the sigmoid sinus is a direct posterior relation to the mastoid antrum, which is a cavity communicating with the middle ear. Also, that the mastoid emissary foramen is closely related to the sigmoid groove. The posterior surface of the petrous temporal presents the internal auditory or acoustic meatus, which transmits the facial and the vestibulocochlear nerves and the labyrinthine artery. This is the foramen magnum, which is the biggest foramen and contains the lower end of the medulla oblongata and the tonsils of the cerebellum. The surrounding meninges transmit the two vertebral arteries and the spinal roots of the accessory nerves and the anterior and the posterior spinal arteries that arise from the fourth part of the vertebral artery and descend into the vertebral canal. The hypoglossal canal is found just below the jugular tubercle, which is an elevation present between the foramen magnum and jugular foramen. The hypoglossal canal transmits the hypoglossal nerve. The jugular foramen lies below the internal auditory meatus and transmits the internal jugular vein into its lateral part, the inferior petrosal sinus into its medial part, and the 9th, 10th, and 11th nerves in between the two venous channels. The superior petrosal sulcus lies on the upper border of the petrous temporal, while the inferior petrosal sulcus separates the petrous temporal from the basilar part of the occipital bone. This sloping surface of the basilar part of occipital bone is called clivus and is related to the pons and the medulla oblongata. It reaches up to the body of the sphenoid to fuse with it at the dorsum celli. Behind the foramen magnum, there is the internal occipital crest, which ascends upwards on the posterior wall of the fossa to reach the internal occipital protuberance, at which the right and left transverse sinuses and the superior sagittal sinus meet to form the confluence of sinuses. Now we are going to describe the mandible. The mandible consists of a body and two rami. The two halves of the body of the mandible meet each other in the median plane at the symphysis mentae, which ossifies by the end of the first year of life. The lower border of the body of the mandible meets the posterior border of the ramus at the angle of the mandible, which changes by age. It is obtuse in young age, perpendicular in the adult, and becomes obtuse again in old age. This is the external surface of the body of the mandible. This is the symphysis mentae, showing the mental protuberance as a triangular elevation having a mental tubercle on each side. Lateral to the symphysis mentae, there is the mental foramen, which transmits the mental nerve and vessels. Inside the body of the mandible, there is the mandibular canal. The entrance of this canal lies on the inner surface of the ramus and is called the mandibular foramen. The anterior border of the ramus is continued on the external surface of the body of the mandible in the form of a faint ridge called the oblique line. The buccinator muscle arises from the external surface of the body of the mandible opposite the three molars. The upper border of the body of the mandible is termed the alveolar process, which carries the sockets or alveoli of the teeth. It should be noted that a gap exists behind the last molar tooth between it and the anterior border of the ramus. The lower border of the mandible is termed the base of the mandible, that gives attachment to the platysma. The digastric fossa is a depression on the lower border of the mandible near the symphysis mentae and gives origin to the anterior belly of the digastric muscle. The ramus of the mandible has two processes projecting from its upper border. The condylar process posteriorly and the coronoid process anteriorly. The condylar process comprises the head and the neck of the mandible. The mandibular notch lies between the two processes. The head of the mandible articulates with the mandibular fossa to form the temporomandibular joint, which is a synovial joint divided by a disc into two compartments. The front of the neck of the mandible gives insertion to the lateral pterygoid muscle. The coronoid process gives insertion to the temporalis muscle. The lateral end of the head is projecting and can be felt below the posterior end of the zygomatic arch. It can be felt moving when the mouth opens. The lateral surface of the ramus of the mandible gives the insertion to the masseter muscle and is covered by the parotid gland. The medial surface of the ramus presents the mandibular foramen, which leads to the mandibular canal that transmits the inferior alveolar nerve and vessels. The medial border of the foramen is projecting to form the lingula, to which the sphenomandibular ligament is attached. Just behind the lingula, there is the mylohyoid groove that lodges the mylohyoid nerve and vessels. Below the mylohyoid groove, the medial surface of the ramus is roughened for the insertion of the medial pterygoid muscle. The internal surface of the body of the mandible presents the mylohyoid line as an oblique ridge that runs downwards and forwards from just behind the third molar tooth to the digastric fossa. The submandibular fossa lies just below the posterior part of the mylohyoid line and lodges the submandibular salivary gland, while the sublingual fossa lies above the anterior part of the line and lodges the sublingual salivary gland. The mylohyoid groove extends below the posterior end of the mylohyoid line. The elevation on the internal surface of the symphysis mentae is called the mental spine and is composed of two genial tubercles. The superior one for the origin of the genioglossus muscle, while the inferior is for the origin of the geniohyoid muscle. It is to be noted that the body of the mandible increases in length by bone deposition on the posterior border of the ramus, accompanied by bone resorption from its anterior border. This gives more space for eruption of the molar teeth. This process also affects the shape of the angle of the mandible, which changes from being obtuse in the young to be more perpendicular in the adult. This was the end of the description of the skull and mandible.